Assalamu alaikum wa rahmatullahi wa barakatuhu. Radio Ansar FM 90.4 and 105.6 Peter Marisburg. Shagufta is here with the program Range Hayat, Colors of Life, and I brought very beautiful colors today with a very beautiful personality, and I have a guest. As the people who are following Facebook, they know who is my guest. First of all, I have to advertise about this. This is NPO program, Ladies Pre-Ramadan Booster Program. Ladies Pre-Ramadan Booster Program, in which we said regain, revitalize, and revamp. Such a beautiful thing, like 3 things we really wanted for all of us. We wanted for that, and how it will be with IMA, and 3 guests will be there: Dr. Zeenat Moorad and Sadia Razak, that dietitian, and our Sheikh Roman. And today I have one of these ladies, and that is Dr. Zeenat Moorad with me, who is a specialist hematologist. When you hear specialist hematologist, you feel a little bit scary and fearful, because hematology is all study about the blood and blood disorders, and and a lot of things, very serious things. But today we are telling that she is gonna be there for tomorrow's program. What are the Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum salam. Thank you for having me on this show.
No, Zeenat, so are you excited for tomorrow's program? What are your plans to talk about, that elevate and revamp and revitalization?
Yeah, so I think it's very exciting. I don't want to give too much of information away about tomorrow, but I think it was an excellent idea to actually have this program, because women need to know how to prepare themselves for a state of health. And health is not just your physical health, it's also your mental health, it's your emotional health, it's everything that you eat, that you consume mentally, psychologically, spiritually. And it will be a very informative, and it will be elaborating on the different aspects of health to make sure that all women can do this for themselves and for the other women in their lives, and also for their children and their husbands, to have the best out of the month and to actually make the most out of the sacred month of Ramadan.
Oh, Jazakallah. Now I wanted to come to you, Zeenat Moorad, right? You have to tell me that where are you working, what you studied, what you are doing for us now. Can you tell us?
So I studied medicine at University of Natal, and I completed my studies in 2005, so you can work out my age.
You don't look like. I'm telling you.
And I've been in practice now for almost 20 years.
Oh my God.
So after doing my undergraduate studies, I specialized in hematopathology. So that's basically looking at blood and bone marrow and things under the microscope. I then went on to do a master's in medicine in hematology as well, in which I did some research, and thereafter I super specialized in clinical hematology. And I think clinical hematology is a very rare niche field, and it's not known to a lot of people that there are hematologists. Even many doctors don't know that we exist. We are a very scarce skill, so there's very few of us based in KZN and countrywide. I think we might be one of the smallest fields of doctors. And we cover a range of disorders that relate to your blood and your blood cells. So these are benign things, benign meaning non-cancerous things, which are disorders of all your different cell lines. And for those of you who don't know what's actually in your blood has liquid, which is called plasma, and your plasma contains all your proteins and your coagulation factors, but your blood also contains blood cells, and those are your red blood cells, which carry hemoglobin or oxygen to the vital organs in your body. If you have a problem in the red blood cells, you could either have your red blood cells decreasing in amount, and that would amount to something called anemia, which is a very common problem that we have. 1 in 2 people are anemic. But on the other hand, you could also have a problem with your red cells where they increase in large amounts and cause complications from that. And that is something that we call polycythemia. We also deal with problems in your blood platelets. So your blood platelets are little particles that circulate in your bloodstream, and if you got cut or injured, they would actually prevent you from bleeding to death. And just like that, there are problems when you have low platelets, so you could bleed. But some people have problems where they have very large amount of platelets and they can actually clot. And the last cell line that we look at is your white cells. And your white cells are basically the soldiers in your body. And there are different types of white blood cells, and each of them can have their own disorder. So we see a range of infections, but the major problem that we deal with is leukemia and lymphoma. So leukemia is a form of blood cancer where abnormal cells circulate in your blood. It can be divided into an acute leukemia, which is a very sudden, savage, often fatal condition if not recognized and treated, or you get chronic leukemias which occur over a period of time and they are relatively more indolent and less aggressive. And then lymphoma. Lymphoma is another huge subgroup which we deal with. We see lymphoma in children, in adults, in elderly people. It can happen at any age group. And basically, it's swellings or growths of the lymph nodes. So your lymph nodes are little glands which drain the lymphatic system. The lymphatic system is present throughout your body. It's used for filtering your blood, filtering toxins, filtering infections, fighting infections. And in certain patients, they are prone to develop lymphoma, or they do develop lymphoma. And this is a cancer of the lymph node, which we do treat. We also look at disorders of the spleen. So your spleen is an abdominal organ. It's found on the left upper side of your abdomen or your belly that you would look at. It's usually under your ribs, around rib 9 to 11. And there are different disorders that can occur with your spleen. You can get massively enlarged spleens. You can get spleens that don't function properly. You can have lymphomas or cancers in the spleen. So it's a very, very exciting profession to be in. Things are changing very rapidly. Even though lymphoma and leukemia used to have such a bad prognosis before, we are so fortunate now to be able to deal with medication and novel targeted genetic therapies that we are using to help patients on a daily basis.
You gave very nice full explanation. Half of it I didn't even understand.
Yeah.
I have to ask you something.
Sure.
Before that, I wanted to ask you, you said this is very rare profession. Like, it's still not like on the surface, people still think, what is hematologist? Why we use, though you are a doctor as well. Why and how did you choose to be the hematologist? Is there any story? Because normally gynae or any kind of, surgeons or pediatricians, and how, like, is there any specific thing happen in your life, or how you choose this field?
So I think it was my faith or my taqdeer that brought me into this, because when I was in medical school and I was writing my final year exams in medicine, which is a part of what we do, all of my clinical cases were actually hematology cases.
Oh, wow.
And the doctor or the registrar who actually took me into these cases and who told me after that, no, you did really well, don't stress about it, ended up being my head of the department for the department I work in. So, I do believe that everything happens for a reason.
Exactly.
And we are destined to be in certain places. And it's something that I love and I'm very passionate about. I love to educate people. I love to teach doctors. When I'm not working, I'm doing lectures, or I'm doing Zoom meetings, or I'm doing CMEs, just to enhance awareness. A lot of the topics are very close to my heart. Like things like iron deficiency anemia, because 1 in 2 women are iron deficient. We'll touch on that a little bit later. But other things like being aware of cancer, being aware of diseases, knowing when to recognize problems.
Exactly, like we can do we can pre-test all those things, blast, and we can control the death percentage as well, and the extremity of the disease as well.
Yes,
especially like you are talking about leukemia.
Yes.
Leukemia, it was a disease that once you find out, that the person is going away, right?
Yes.
But now you are telling people that, no, this is awareness of this thing as well.
Yes.
That, no, we can control, we can help them beforehand as well.
And now we've got treatment that's not chemotherapy anymore. We use molecular genetic targeted therapy. So we have patients with acute myeloid leukemia who can be treated at home, who
My
can go
God.
home and take their medication and come back to us on a weekly
Wow.
basis.
This is very
It's
good news,
phenomenal.
phenomenal, extremely
it
good
is.
news. And you say genetic molecularism, because I did my master's in genetics, so I do understand about the chromosome additional and chromosome,
Yes, and all the
characteristic
epigenetic
changes. We can do
Yeah.
that. That's amazing. Hope we can get with other cancers to this
Yeah.
kind of
So
treatments.
The fascinating thing is, so when I was
Wow.
studying epigenetics for my first exam, which I
Okay.
think I wrote in 2010, my first specialist exam,
Yeah.
I was learning about epigenetics. And
Yeah.
epigenetics is basically something which changes the environment in which your genes works without actually changing your genes themselves. So it changes how things will translate. And now when you look at different disease entities and other different fields, you'll see even the dermatologists are speaking about epigenetics. The surgeons, everybody's looking at epigenetics. So it's a very exciting time to be in medicine, and it's very intriguing and fascinating. And as I tell my children every day, we learn something new every day.
Every day.
And this is a field where literally we are learning something new every single day.
Oh wow, you are really giving us a beautiful, nice information, and which is I'm very happy that without chemotherapy, which is very annoying and very, it's hurtful. According to me, it's hurtful, because my mother also been through with chemotherapy with the breast cancer. So it's very good news. If we could have, even now we have, for the knee things, they're doing some epigenetics to take the control of the knee movement as well. The epigenetics, they are doing a lot of work. Hope, inshallah, in future, in 5-10 years, we'll have the solution for all the diseases.
I think it's coming. Eh?
It's coming.
It's coming. Watch the space. Yeah.
Oh wow, that's a very good news.
Already we do. So what we also do is we do stem cell transplantation.
So that's where I'm coming. That stem cell is the solution as well.
Yes. So stem cell transplantation is curative for patients with leukemia.
As well as
So, and we also do stem cell transplantation for patients with lymphoma. We do stem cell transplantation for other patients with solid tumors like neuroblastomas, nephroblastomas, even things like multiple sclerosis. We can do stem cell transplantation. So in the other countries, stem cell treatment is actually approved for other things such as shoulder injuries, and knee injuries, arthritis, everything. But in our country, at the moment, it's only really approved for leukemia, for lymphomas, for myelomas, and then for multiple sclerosis.
Okay. Now we spoke about with Dr. Zeenat Moorad about very on a level that we wanted people to be aware about this hematologist specialist, and they are really lifesaver now, whatever she's saying. But today my program is for Ramadan. Although I'm not telling her, not stealing her the whatever she is going to talk tomorrow at IMA. Can you tell us the timings of this program, Zeenat?
So tomorrow's program is divided into 3 different parts. I know I have a half an hour segment. I'll just tell you the times. The program starts from 9:30 for 10 o'clock, and I will speak, I think, from 11 to 11:30. Yeah, but I think if you're coming for the program, make sure you're there for the entire program, because each of the different speakers will give you a different focus and will give you, together you'll have a complete picture. Don't just come for one of the aspects.
So
of
it
the
will be by
program.
IMA.
Yes, so tomorrow's program is going to be at 36 Hatton Avenue in Sherwood, and that's the Baitul Noor, IMA Baitul Noor. And if you need booking, if you need tickets, or if you don't have tickets, I think you can call 031-209-7838. That's 031-209-7838. And the tickets are going for just 50 rand per
just
person.
for the nominal.
I think it's for the amount of information that you're going to get. It's very, very, beneficial for you. Or you can email Shakira at baitlnoor.org.za. That's Shakira with an H at the end at baitlnoor.org.za.
Okay. And now I wanted to catch you for my program, Lifestyle Range Hayat, that always talk about women's problem related and everything. Please don't hide the things for my listeners.
No, I won't.
See, in Ramadan,
Yes.
right? We all wanted our energy level high.
Yes.
But automatically, when it comes to the monthlies,
Yes.
our energy level goes very down, very low, right?
Okay.
Even our children, grandchildren, they look very, very low and very moody. So what do you think what we should do, like how we can save our energy or make our energy during that period?
Okay, so I'm going to first speak specifically about women and menses and menstruation, right? So iron deficiency anemia is something that we're seeing in every second person. It's happening in males, it's also happening in females, and we never thought it would occur so much in males, but we are seeing it.
Okay.
The problem in females is that often they have very heavy abnormal menstrual periods.
Yes.
Which they often regard as normal because their sisters have this sort of menstrual
They're coming
period.
from
Their
families,
mothers have
yeah.
this sort of menstrual period. The grandmother has had, and it's regarded as normal. But a very heavy menstrual period is actually not normal.
No.
And there is a type of bleeding disorder, the commonest type of bleeding disorder, which we see in females. It's called von Willebrand's disease, and it's a very mild type of disorder. But it's a platelet disorder, and that is what is involved here. Women will frequently bleed excessively heavy during their periods. They may also have nosebleeds at certain times. They may report sometimes, if they've had a dental extraction or a tooth extraction, that they've bled for a bit longer. And how we actually diagnose this is a woman sometimes needs surgery, or she's going to theater, and the doctors will do a bleeding time, and they'll say, but this bleeding time is increased, and then they'll call me to see the patient. And then we actually find that this woman, her whole life, has actually had a bleeding disorder that has been undiagnosed.
And she didn't even know, she just took it as a normal.
She didn't know because it was normal, and it's a genetic thing. So everybody in the family's got this, So bleeding disorders are often under-recognized. If you are having heavy menstrual periods, get tested to see if you have this type of bleeding disorder. And the second thing is to control the bleeding. So how do you control the bleeding? Because chronic severe bleeding gives you iron deficiency anemia.
Yeah.
And now the World Health Organization states that you don't even have to become anemic to be fatigued. You just have to be in the stages of iron deficiency, and already you're not functioning, on all levels. So if you have this, if your daughters are bleeding very heavily, often we say that, once teenage girls start to menstruate, they can have very irregular, abnormal periods. You need to be on some sort of iron supplementation, right?
Oh,
so
that's very important.
very
From
important. From the time young females start menstruating, put them onto iron supplementation, right? Women and families are very reluctant to take oral contraceptive pills to regulate periods. So they'll often tell you, no, I don't want to give my daughter this, or I don't want to give my daughter that. And we can't force anyone to do it. But there are other tablets that you can get, which are called antifibrinolytics. And these actually decrease the amount of bleeding and the duration of the bleeding without affecting the menstrual period.
Okay, I wanted my listeners you to repeat for them that not contraceptive.
Yes.
Beside contraceptives, we do have some tablets that can control the heavy bleeding.
Yes. So these are called antifibrinolytic drugs. There's a few on the market. Some are cyclocapron, others are things like Tranic, and they can reduce menstrual bleeding significantly.
Okay.
You take it during the period, they can decrease the amount of bleeding, and they can decrease the duration of the bleeding. The other problem is when girls or when women bleed, they have a lot of pain. So they have pain at the back, they have pain in the tummy, they have pain in the neck, they'll complain of headache. And what we find is that the first thing people reach for is a Disprin or a Grandpa or a Nurofen or something with aspirin.
Yeah.
And that is a huge problem because aspirin-containing medications impair your platelet function. So they actually make your platelets unable to function, and you will bleed more. Even though you are controlling your pain, you are going to bleed more because you've now made your platelets dysfunctional for the half-life of that drug. So if you're taking like aspirin or Ecotrin, it's about 5 days that you make and you'll know this because if you've ever known somebody who's gone in for a surgical process, and the doctor will say, have you taken aspirin? Have you taken Ecotrin? They will never operate on you because they know that the risk of dysfunctional platelets
will be there.
is very high. So nobody, even if your platelet count is normal, nobody is going to operate because of the risk of bleeding. So that's important. Cut down the period duration by using the medication. Use painkillers that do not contain aspirin.
Again, I have to repeat for my listeners that remember that taking the aspirin, Disprin, or anything like with Nurofen, which aspirin is not nice. So even if you are in pain, you can take the other painkillers which does not contain aspirins as well, and try to avoid that because we don't understand. But these kind of specialists, when they come on the program, they are telling, but say something going to happen with the platelets, and we don't even know what platelet. As long as my pain is gone, so please ignore that.
So there are other things that you can take. So paracetamol derivatives, so Panado, still pain. Ponstan works very well. Ponstan. Okay. It's a capsule. It works really well to alleviate pain. It can really relieve your discomfort. We know that the time of the menstrual cycle causes a lot of distress, a lot of anxiety. Young girls are going to school, they're worried about heavy bleeding, etc. So there are methods and measures that you can take, to make them more comfortable and to prevent them from becoming iron deficient.
Okay, I have one question from WhatsApp as well. Salams, what happened if spleen removed? How it affects
Okay, so there are some conditions where we need to remove the spleen. We don't actually do it much anymore because we've got newer targeted therapies. But your spleen's major role is as a filter, so it filters infection, and it also filters your blood. So toxins and things are removed from your spleen. Okay. But in some patients, their spleens do become massively enlarged, and it sort of eats up all their blood. So they need to have it removed. The two biggest complications of removing a spleen are that you can get overwhelming post-splenectomy infection. So you can get infections after removing the spleen.
Just for that time period or
regularly? So how we prevent that is we actually vaccinate patients.
Oh, for that.
We do vaccinations of patients before splenectomy, before we take out the spleen. Okay. And then we regularly vaccinate patients every 5 years with things like pneumococcal vaccine, etc. And we advise them to get other vaccines like the flu vaccine. The other problem with taking out your spleen is that you can get blood clotting. So because the spleen is not there to filter your blood, you get a massive increase in your platelet count, and patients may develop blood clotting. So DVTs, you may have heard of DVTs. Patients can get that. So a lot of patients will actually need to be on aspirin or Icotrin post-splenectomy just to control that platelet count and prevent the platelets from sticking together and forming blood clots.
What an informative program you're giving me, Zeenat, Moorad. I'm telling you, and I'm feeling so good because I remember my days, and I left my studies after. Okay, this has happened very little time we have, but I'm not saying anything about my Shagufta ji ke totke because Shagufta ji ke totke is coming from Dr. Zeenat Moorad today. So now for Shagufta ji ke totke, I am asking about we young teenagers have lots of problem of pimples, acne, and this, and because I'm a beautician and I'm not a skin specialist, but as a beautician, I am I can talk about the skin and doing, a lot of, I have my own organic product, Asli, which we are using all the nanis and dadis, and nowadays everything is very natural, organic product. I'm using like aloe vera gel, using almond mask, using flaxseed gels and everything to control all these things. The cucumber gel I'm using. I'm into that. But I, being you, such a specialist, I wanted to take a little bit more information from you. First of all, how we can control, it's anything to do with the blood as well, with this acne, teenage acne and acne prone skin and pimples, so much of pussy pimples, and how can we purify our blood?
Okay.
Two things.
Okay, so your blood, like I said, has plasma and it has your different type of blood cells.
Yes.
Plasma transports liquid proteins and antigens, and if your blood is very thick and sluggish and slow moving, it will remain stagnant, or it will have something that we call stasis that can cause clogging of the blood vessels, and that can appear on the outside. So the best thing that I would, because I have a 12-year-old daughter, so trust me, I have this pimple acne story all the time, you know. So I do know there's a genetic component to acne as well.
Yes.
Right? But the most important thing, I think, is, and especially for young skin and young faces, is to make sure that they're drinking enough of water. Right? No carbonated drinks, no fizzy drinks. Fruit juices have high amounts of sugar, of calories. Those all influence your skin. Things like some people will say, I eat a piece of chocolate and I get a pimple. I know I will eat a piece of achar and I get a pimple, you know. So there is a dietary component. When we talk about purification or detoxification, we must remember that it's the liver. The liver that is our site of purifying and detoxing the body and the bloodstream. So we need to have a healthy liver. And how do you have a healthy liver? You have a healthy liver by, number one, eating well. So you decrease the amount of junk foods, oily foods, greasy foods. You increase the hydration status. So you prevent dehydration, because when you drink a lot, you've got to increase filtration through the body, through the organs, through the kidneys. All your toxins get flushed out of your body. And often you will notice that people who have pimplish skin, they don't drink a lot of water.
Or they drink a lot of fizzy drinks. And chocolates.
And junk food. So oily things.
100%, yeah.
Exercise is absolutely crucial to giving your skin glowing and radiance and good health, because it decreases your pore size, it increases your circulation. You know, I also advocate for patients or for young people to steam their faces. Instead of going on to very high-end, high-schedule acne medication, you know, going on to chronic antibiotic therapy. All of these drugs have side effects.
Wait, I have to stop you here, because pause you here, not stop you.
Okay.
This is my motto for the young girls who have pimples, who have acne, that please keep away. Now I can see that our specialist is doing the second, telling me that like, you know, that we cannot have this kind of antibiotics, and because the side effects will be there, because we study biochemistry and we know what a side effect is very bad. So please keep in your mind that with your healthy lifestyle, when you're keeping your liver healthy, you can get rid of all those problems. There is one more question is here, that Assalamu alaikum sisters, please, I missed the name of the medicine to help with the excessive bleeding. Jazakallah khair. What medicine you are telling?
Okay, so it's an antifibrinolytic agent. Before buying things yourself, I do think though you should take your daughter to, or yourself, to at least a general practitioner to let them do an examination on you, get a proper history, see if there's a family history of this. Right, cyclocapron or Tranic are the medications that we do use to decrease blood counts, but you will need a script for it, so you will need to see a doctor before.
Yeah, so you can continue for that. We cannot use a lot of antibiotics.
Yes, so antibiotics, topical things that, you know, people are applying to their faces. My daughter tells me a lot of the girls are taking Roaccutane, which is these vitamin A derivatives, and they do have long-term risks to the skin. They have risks of cancer, they have risks of affecting your liver. So you want to start off doing the basic things that you need to, and only if it becomes a problem. And remember, 1 or 2 pimples are not a problem, you know, that's normal. You're going to get, people will get pimples with hormonal changes. During your menstrual cycle, you have hormonal surges. During pregnancy, people have hormonal surges, so it leads to acne, which can be quite severe, and it can be quite it can affect the person's self-esteem, and so they want to quickly treat it. But there's no such thing as a quick fix. You know, it's a process of caring for your skin, caring for your body, eating well, drinking enough, doing exercise, hydrating yourself. It's an entire process before you run to that tablet or that ointment or thing that's prescribed. Yeah.
Such a beautiful, informative program from doctor specialist of Zeenat Moorad, and I'm very excited today to get all the informations, and hopefully my listeners also very excited to know few things that we cannot just start using the medicine and and making it easy. So please drink a lot of water and have your iron intake as well, regularly, even if you can do it with the diet as well.
Yeah, I think the other part we spoke about was getting your energy levels right during the month of Ramadan. And a lot of people are taking vitamins, but they're taking it with all other sorts of things. So an important thing to remember is if you're taking iron and iron supplementation, you should not be taking it with tea. You should not be taking it with coffee. You should not be having your iron with your meal. You should not be having your iron with your calcium tablet if you're taking that, because all of these things impair the absorption of iron. If you're taking iron supplements, you should do it in the morning on an empty stomach, at least an hour before your meal.
We have very less time, but inshallah, hopefully, I will get the sister again in my program just to get all these supplements and iron tablets for, so it'll be more information. Jazakallah khair. I really appreciate that you left your so busy schedule and you came. Jazakallah khair. And to meet her tomorrow, you people can go to IMA Bethanoor to get more information. Ijazat chahti hu. Assalamu alaikum wa rahmatullahi wa barakatuh.